to do it yourself. That's what happened in a little town just across the Hudson River from here. They solved a problem all the political bigwigs in Washington couldn't, and it didn't cost taxpayers a cent. Dr. Timothy Johnson with a simple plan that simply worked.
This is Red Bank, New Jersey, a charming little town. But even this idyllic place cannot escape the crisis that threatens nearly every city, town, and village in America. The danger is our healthcare system and what it's doing to people without insurance, like Richard Mammy. He drives a taxi here in town, but doesn't get health insurance. Richard suffers from diabetes and can't afford the medical care he needs. He had nowhere to turn.
If you don't have medical insurance or a lot of money, you're in trouble.
Hi, Jane. Dr. Cheslock, how are you?
It's a problem Dr. Gene Cheslock sees nearly every day. One of Red Bank's most beloved physicians, he's been on the front lines of medicine for nearly 40 years.
Let's face it, we have Doctors Without Borders. They'll fly to Guatemala, they'll fly to Africa. Well, we have that need inherent in America.
Red Bank, like many American communities, is a tale of two cities. Incredible wealth, living side by side with working people the healthcare system seems to have abandoned. It's an enormous problem, but Gene Cheslock always believed that doctors can make a difference.
Within most of us in medicine, there is the spirit to give back or just to give.
But what convinced Dr. Cheslock it was the time for a new and daring endeavor was what this man discovered. Dr. Donald Warner, a former school superintendent and a local Baptist minister, set out on a mission to see exactly how bad health care was for Red Bank's working poor.
I was actually shocked, given the numbers of persons who were without health insurance.
He went to 400 households, door to door, and determined that 95% of the Hispanic households were uninsured, and roughly 30% of the Afro-American households had no health insurance.
For Gene Cheslock, it was a clear call to action. He pitched a plan for a free health clinic to Red Bank's mayor, Ed McKenna.
I intentionally felt that the town should distance itself and it should function as a facility on its own so that it wasn't seen as a form of welfare or anything such as that.
In other words, no money from the town of Red Bank. The mayor promised support, but Dr. Cheslock was left to find his own funding. He rolled up his sleeves, and soon a local construction company rolled in with the first major donation, an old trailer to be converted into a clinic. But then a second obstacle hit. The tough Red Bank zoning board voted to pull the plug. Jim Irving recalls what happened at the 11th hour that made them change their mind.
I think it was almost like a bolt of lightning. It hit me that if anything went wrong, and if they either abandoned it or it wasn't successful, we just hook a truck to it and tow it away.
And finally, there were the skeptics who said the town's illegal immigrants didn't deserve access to the clinic.
What kind of resistance did you run into? Who were the naysayers?
These were some prominent individuals in the community. And my retort to them was, who takes care of your children, who mows your lawn, who paints your house, who waits on you in the restaurant? And it shut the naysayers up quickly.
So in these humble beginnings, a trailer in a parking lot, the Parker Family Health Center officially opened, named in honor of Dr. James Parker Jr. and his father, Dr. James Parker Sr., both revered African-American physicians who had selflessly cared for generations of Red Bank's poor. The local hospital donated equipment. Doctors and nurses volunteered their time. The first night in July 2000, the clinic had 3 patients.
Honestly, in your own heart and mind, as this idea was first being tossed around, did you think it would succeed?
I thought it had a chance, Tim, but I never thought it would succeed the way it has.
Hi, Carl. How are you today? Okay, and you, Doc?
Today, the Parker Clinic has more than 6,000 patients, men, women, and children, including Richard Mammy.
God bless each and every one of you here, godsend.
It was good seeing you again.
Thank you.
It's easy to see why patients love the Parker Clinic, but the doctors who volunteer here might actually love it more.
We're practicing here the way I practiced when I first started, you know, without worrying about lawyers looking over your shoulder, without worrying about papers and forms and HMOs and all that other garbage.
The Parker Clinic is based on a model called Volunteers in Medicine, started about 10 years ago. Today, there are 25 similar clinics throughout the country, serving hundreds of thousands of patients, and 40 more are in the pipeline. Amy Hamlin is executive director of the Volunteers in Medicine Institute.
What do you say to people who say, this is a noble effort, but basically you're just prolonging the agony, the need to really change our healthcare system in a pervasive way, in a political way?
We don't take a political stance. We want to get services to people when they need them, and they need them now.
It costs $500,000 a year to run the clinic. Most of the money comes from local businesses and residents. It certainly helps that one of those folks is rock star Jon Bon Jovi, a hometown hero who grew up in the neighborhood and has never forgotten his roots.
1 million people in New Jersey are uninsured. 200,000 of them are kids. How could I not get involved? You know, this is my backyard.
So when it became apparent the Parker needed a bigger home, Dr. Cheslock turned to John and his wife Dorothea.
John and Dorothea are very community-rooted, very basic people who appreciate where they came from, where they are now, and their obligation to give back to the community.
The Bon Jovis hosted a number of successful fundraisers, but the event everyone in town still talks about is John's one-night concert at the local high school.
It's all the same. All it needs a change.
This structure today is just a symbol.
And so, that's how it came to pass. On a sweltering day this past July, almost 3 years to the day the clinic first opened in a trailer, that the Parker Family Health Center moved into this beautiful home, completely paid for.
Gene Cheslock made a difference here in the community because Dr. Parker and his father made a difference.
Jon Bon Jovi spoke to the crowd about the legacy of care that now defines their community.
And I think what I'm going to ask you is to inspire someone, especially yourselves, to make a difference.
Dr. Cheslock ended with the lyrics from the Depression-era song, Side by Side, that to him says it all.
And it ends with, I think, the most poignant phrase of all. We'll travel the road, sharing the load, side by side.